This is Han Jung-kum, a spine specialist at Wooridul Spine Hospital. I've been working at Wooridul Hospital for over 10 years. I see a wide variety of patients. People visit us with various ailments in their neck, back, and waist. Fortunately, I haven't had any problems with my back so far. I try to exercise hard, but I think posture is very important, so I try to make it a habit to live with a good posture. The reason I first did neurosurgery was because I wanted to study the brain more. There are actually not many doctors who can perform brain surgery. So, I started out to become a doctor who could treat brain. As I studied, I became more interested in the spine. The spine is usually treated when there is a malfunction. Symptoms improved quickly with treatment as patient satisfaction increased. I became interested in the effects of treatment. Also, the reason why I came to Wooridul Hospital was to find a treatment that can increase satisfaction in a smaller way. I looked for a good hospital among them. Wooridul Hospital seemed to be the leader. Wooridul Hospital is a world leader in minimally invasive spine surgery. Anyone who asks this will admit it. The biggest advantage is that I was the first to start endoscopy at a time when others could not. So even now, endoscopic treatment can be performed in a variety of ways. Of course, it applies to both the neck, thoracic and lumbar. Surgery can be performed in a variety of ways. First of all, there are many different types of minimal invasive surgery. Most of these are treatments that can minimize the recovery period after surgery. We treat the most patients can be discharged within 1 to 3 days. In fact, patient kept dragging the disease on without treating it. In the end, there are cases where the disease becomes so severe that treatment does not produce satisfactory results. If you suspect you have a spinal disease and are experiencing discomfort, the most important thing is to get a diagnosis. It is also very important not to miss the timing of treatment. That's a very big misunderstanding. I actually meet many patients in outpatient clinics. If surgery is necessary, I advise them to have surgery. If a simple procedure or injection treatment can solve the problem, I recommend trying that first. After diagnosis, treatment methods vary depending on the condition. You shouldn't visit me thinking you're going to have surgery, but you should think of visiting to find out what the disease is. As Wooridul Hospital has been around for over 40 years, it's true that a lot of people with very serious condition come see the doctor. They receive various types of treatment, including injections and procedures, at nearby hospitals because most of the cases are not resolved. That's why it may seem like a lot of people who undergo surgery here, but this is done because the diagnosis of the disease itself requires surgery. If it can be treated through injections or procedures, I treat patients this way. The most important thing is diagnosis. Through diagnosis, you should find out what your illness is because it is important to treat accordingly. Wooridul Hospital always treats in this way, so don't delay too much and visit at the right time. It would be better to get treatment. Thank you.